Hello, I'm Jeff Patterson, Nacogdoches Medical Center Chief Executive Officer, and welcome to our next edition of Ask a NACDoc. We're fortunate today to have Dr. Mary Hebert, our radiation oncologist. Welcome, Dr. Hebert.
Thank you. Glad to be here.
Excellent. Well, today one of the things we wanted to discuss was cancer care in Nacogdoches. I think a lot of folks are not aware of the services we have, both in medical as well as radiation oncology, and so I brought the expert here today to talk a little bit more. So, Dr. Hebert, talk a little bit about what you do and about the services that are available to the community here in Nacogdoches.
Well, cancer care is actually three-pronged. We have surgery, medical oncology, and radiation oncology, all of which we do have here in town. I do the cancer treatments, what we call zapping patients, some people like to say, but we help to treat more locally. So we're helping with where the tumor is and where it might spread in the local area, or we're helping with problems, pain, an area that has spread but is only one area. Still trying to make it go away, stay away. Whereas medical oncology is going to be the branch that will give drugs or targeted therapy, that's a new term these days, to go all over the body to help with cancer. Surgery helps locally. Surgery will take out something that is only where it started, for instance, a lung cancer, where they can take it out, or a colorectal cancer where they can take it out. And then we work to help them to make sure that all the cancer cells are gone.
Well, there have been great outcomes here under your supervision, and can't thank you enough for your medical leadership. Could you expand upon the technologies that we have here in radiation oncology? I know we just purchased a new linear accelerator in 2018. What does that give you the capacity to do for our patients?
Our linear accelerator that we have now is capable of treatment up to what we call SRS, which is stereotactic radiosurgery. That means that we can do very precise fields for brain tumors, brain metastases when that's appropriate. We can also do stereotactic body radiotherapy, which means that we can give very precise treatments for localized tumors. For instance, in the liver, we've done SBRT, or in the prostate, we've done SBRT. Those allow us to treat with millimeter accuracy, very little normal tissue, but the tumor has to be appropriate for that. Our more normal treatments are what we call IMRT or VMAT, which means that the machine swings around the patient and misses as much normal tissue as we can while getting all the dose to one area. So most tumors these days are going to be treated with that type of format. And we can do all of our blocking very specifically for the patient while that machine is moving. So the machine is treating on the fly as it goes around. It's kind of a nice technology. So we're able to do pretty much anything that we need to do in this area.
That is amazing. And I know that you have a lot of partners throughout the state. You know, cancer is a condition where people seek out first opinions, second opinions, third opinions, appropriately so. And then a lot of times they end up saying, okay, well, I've got the opinions, but I want to get care here because I know the technology and acumen exists. How do you interact with an MD Anderson or other kinds of, hospital or healthcare organizations to combine and complement the care and advisory given to patients, but then also help treat them locally?
For me, what I tell people is it's your body, and you always are welcome to a second opinion. And if there's something out there we don't know, we need to know it. So I have no problem with that. Once they have become comfortable with what they want to do, we can coordinate with whatever care team they have put together, whether that's all local or whether that's local and with people that are further afield, just to make sure that everything's coordinated as smoothly as we can make it. We want to make care as easy for patients as we can and still cover all the bases.
It's fantastic to be able to have you and Dr. George here locally, as well as the infusion center for chemotherapy and other medical oncology infusions, and then as well as the radiation therapy that comes in your department. What are the advantages as you see to folks seeking treatment locally? I know there's a lot of repetition with as far as treatments go.
So for medical oncology, treatments are given usually every 2 to 3 weeks. There are some regimens that are as often as every week. So disrupting to try to drive somewhere else, stay overnight, get back home, that's very difficult for people. But when we're talking radiation therapy, we're talking every day, and that can be anywhere from a one-time treatment to an 8.5-week treatment.
Wow.
So when you're having to go in every day and the treatment itself is only about 15 minutes in and out of the department, driving 2 hours to get a 15-minute session is prohibitive. It's costly. You're going away from your family. You're not being able to take care of the things you need to take care of day to day. So we want people to be able to take care of things at home and still get good care if we can.
Well, we are so very fortunate to have you in Nacogdoches. I ask, what drove you to come to Nacogdoches and your passion to be involved in cancer care here?
I love the area. I was raised in the Piedmont of North Carolina. This is green and with tall trees, looks a lot like home. So it's a beautiful area to be.
Well, thank you, Dr. Hebert, and also thank you all for joining us here for the Ask a Nac Doc with Dr. Mary Hebert, Radiation Oncology. Again, my name is Jeff Patterson, Chief Executive Officer for the NMC Health Network. We look forward to seeing you again next time. Thank you.